This is Jocelin Sisto. I'm a physician assistant in plastic and reconstructive surgery. We're going to be talking today about maximizing results with Fractora, specifically focusing on high-powered Fractora and combination therapies. I am, like I said, a physician assistant. I've been in the cosmetic industry for several years. I've spent a good portion of my time in clinical practice as well as educating future PAs, plastic surgeons, and medical students. My current practice experience, I am working with a solo physician in plastic and reconstructive surgery. I joined his practice in 2001 and have been with him, and during that time introduced non-invasive procedures in the practice, grown that aspect of the practice, as well as assisted in the operating room, seeing patients independently with him, and also growing our staff. Our office offers the following services, including IPL, laser hair removal, chemical peels, microdermabrasion, all of the InMode technologies, multiple neurotoxin injections, and multiple filler injections. The way our office is structured, Dr. Buttar will see patients in consultation. A lot of times we tag team the surgical consults together. He sees part of it, I'll see part of it. Sometimes he'll do non-invasive consults. Most of the time that goes to myself or our other physician assistant. Dr. Buttar also will do the injectables, and he will perform intraoperative dermabrasion. However, now that we have the Fractora, we've been using that a lot more. I see patients for all of the non-surgical consultations. I do all of the non-surgical procedures, including lasers, the RF applicators, IPL, laser hair removals, the injectable neurotoxins, fillers, microderms, and chemical peels. We also have a CNA, and we're recruiting an esthetician currently to do the microdermabrasion, RF treatments, and some laser hair removal. The business aspect. I am very involved in the business of our practice, specifically in the marketing. We do a lot of in-house marketing. It's very cost efficient and we get a good return on that. We do a lot of email communications with our patients as well as in-office specials, especially if patients come in. Usually they're referring their friends too. So we like to keep things always in communication to keep our patients coming back. We also are very active in our hospital and utilize as much of those resources as possible to get new patients in the door, as well as community programs. Our pricing in general is on the higher end of things just because of the teaching experience Dr. Buttar and myself have. Typically right now what we're charging is $850 per session for Fractora for the face, and that is for 3 to 5 sessions. If we combine the Fractora with a surgical procedure and I max the settings out, that price will range anywhere from $1,500 to $3,000. Compared to other technologies, how does the Fractora fit in? Right now it fills in the gap where traditionally you would see someone with these wrinkles you just couldn't quite clear, or maybe they had an IPL and they weren't happy because they didn't get as much tightening as they wanted. You really can tailor Fractora from a very mild setting to a very aggressive setting and get everything in between. Nothing gets left out. So any of the patient's concerns can be addressed with one handpiece, which is great. From a financial sense, it's an easy add-on procedure, especially if you're already doing surgical services like we are, facelifts, blepharoplasties. You can combine them pretty safely as long as you avoid some of the skin flaps. There's a relatively low overhead. The hand pieces are pretty inexpensive as far as things go, and that price is built into the patient's cost. You really see a great return on investment in a short amount of time because of the price point of what you're charging for patients, and patients are so happy they can't wait to come back and tell their friends about it. So let's go into more detail about the Fractora. How I position the Fractora to patients. Typically my patients are anywhere from mid-30s to 80 years of age. 70% of them are female. The demographics kind of range all over the place, but the bulk of our patients are middle class to upper middle class. And I do treat pretty much skin types 1 through 5. I usually tell patients downtime, if we do it in the office, we need 3 days where you're going to be in Aquaphor, where you're kind of holed up in your house, you're not doing too much. If we max the settings out, I do tell my patients plan on 5 days in Aquaphor. I tell them, we do this procedure once every 6 weeks. Maybe 2 or 3 times depending on how the settings go and depending on what the results are and if they're happy with them. They should see a big gain and in a way kind of reverse the signs of aging that they've seen over the years. I also give them before and after pictures during my consultation, and typically those speak for themselves. I try and show them the pre-op, immediately post-op, so they know what they're getting into and know what to expect. And then I also show them a week and then 6 to 8 weeks later if I have it, so they can see that this is something that's building over time. How Frectora works. It's different than anything else that's out there, and there's a little bit of a learning curve when you first start doing this. A lot of the things we've used in the past, and we'll talk to this briefly, the CO2, the erbiums, the YAGs, and everything, you see that change almost immediately, and you see the changes going forward. Frectora is something, yes, you will see changes immediately, but it does take time for that collagen to build. So you have your ablative zone, your coagulation zone, and your zone of heating. And these three different layers are unique to Frectora, and this is what's giving us the results that we're seeing. We're seeing the reepithelialization occur very quickly, and the phagocytosis, which is important for remodeling in the dermis. This remodeling is going to continue to take place over the next several weeks and several months. What that's going to allow for is a thicker dermis, improved texture, and decreased dyschromia. So when to use which tip when? This is something that everyone needs a little time to learn about, and the 60 pin is really going to be your workhorse. This is going to get your moderate density pigmentation. It's going to give you some moderate to deep RF stimulation, and it will get some of the superficial mottled looking appearance of the skin. So anything that's higher up in the skin or mid dermis, you're going to use your 60. Things that are just superficial, you're going to stick to the 126. The pins are much closer together, so you're getting a higher density concentrated area of treatment. So anything that's really concentrated you want to address, you're going to use the 126. Now in my practice, I rarely use the 126 because I really feel the 60 pin addresses almost everything. The 24 tip pin, this is the one that's going to go nice and deep. You really get a nice ablative zone into the dermis, and this is what's going to allow for a nice remodeling of those deep wrinkles that we see. The silicone coated pin is also fabulous for skin laxity. Now the difference of when to use the coated versus the non-coated would be when you don't want this whole ablative and coagulation zone to go from the epidermis down to the dermis. The silicone coated will spare the top and just do tightening. Most of the time I want to see that zone from top to bottom, especially if I'm doing a scar. So again, like I said, coated would be for skin tightening. So how does Frectora stack up? Some of the things we've used in the past that I'm sure all of us in this industry have been familiar with, the erbium, the CO2, and some of the lasers, all address different things. So in order to address texture, tone, pores, resurfacing wrinkles, deep wrinkles, tightening the dermis, and rejuvenation, you'd have to use 3 different devices. The nice thing about the RF is you can tailor the treatment to get one aspect or all of these aspects together. And instead of using 3 devices, you're using 1. The RF itself is colorblind, so for patients that have more pigmentation, you're not as worried about hypo or hyperpigmenting their skin. However, in darker patients, you are always going to be concerned about post-inflammatory hyperpigmentation because you are causing a thermal injury. So when I talk to patients and about the benefits of RF and compared to other devices, I am going to tell them there's considerably less downtime, especially when you look at traditional CO2. There is a risk of post-inflammatory hyperpigmentation, but it is slightly less than the other modalities. It's a workhorse for the face. You know, we're finding more and more great applications on the neck and body. The results are amazing. They're blowing everything I've seen in the past 10 years out of the water as far as what you can get and the amount of rejuvenation you can see in patients. The other thing I want to consider is medications too. Now, I've treated patients that have been on Coumadin and Plavix, and I haven't stopped the medications, but you do need to be aware of it, and you also want to make sure you get clearance from their cardiologist or whomever is prescribing that medication before you treat them. So, Frectora is a revolutionary new technology that addresses the effacement of moderate wrinkles. It's comparable to the CO2. safely rejuvenate the neck with profound contraction. So patients that aren't surgical candidates will get a huge improvement from this. Cystic acne and acne scars are showing great improvement with the Fractora, more so than you would think. It's not very intuitive to think it would help cystic acne, but when you look at the science behind it, it makes sense that it will be improving. It greatly improves scars in the body, and it's safe for ethnic skin with little to no risk of post-inflammatory hyperpigmentation. So my experience with ethnic skin. I am always concerned about post-inflammatory hyperpigmentation. I'm always conservative. I always, when possible, pre-treat for 2 weeks before and then start hydroquinone 3 to 5 days after the Fractora. I have not had any change in any of my patients in their pigmentation with this protocol. I would err on the side of caution rather than treating the post-inflammatory hyperpigmentation. So I am a little more conservative in that sense. Except for this lady, and which is why I put her in here. This is a lady that was going to the OR for abdominoplasty and breast augmentation, and Dr. Batar had talked with her because she was concerned about her neck. So he talked with her about Fractora. The day of surgery, she decided to have Fractora added on. And as you can see here, she's got this deep wrinkle. Her jowls are casting a nice shadow over here. And in the submental area, she has some laxity. So those were her main concerns. She was not pre-treated with hydroquinone. She has a Fitzpatrick type 4. And I maxed her out. I did a 24 tip, 62 millijoules per pin, double stacked along the neck in this deep wrinkle right here, and in the submental area. With a 60 tip pin at 50 millijoules. And the reason I pulled back to 50 is because I wasn't sure what was going to happen as far as if she was going to have an aggressive post-inflammatory hyperpigmentation response. Now, this picture is 18 days after Fractora. You can see the wrinkle has lessened. It's less deep. The fold over here is less obvious. This one is less obvious because you see the pigmentation here. It's much more balanced there. The jowl has lifted, the shadowing is less. Now the submental area is the least bit responded in 18 days. Now the thing about Fractora is you will continue to see this build over time, and this will tighten. For this lady, however, we decided to add Forma as well, just to get an extra boost to tighten up the submental area. So wound healing with fractional RF ablation, what do we see? Immediately we see some shrinkage. You're going to see that tissue contract around the needles. You're going to feel the pull. And then within 24 hours, 24 to 48 hours, you will have reepithelialization. During this time, there will be erythema. That'll last anywhere from 4 to 7 days. Now, the beauty of this is 30 days later, you've got new collagen being formed. So for several weeks after the treatment, the patients are going to look better, and you're going to tell them that, and they're going to say, I didn't believe you, and then they're going to come into your office and say, oh my gosh, I look so much better, I didn't believe you, and it's fabulous. So I will have more pictures of that lady, it's just that we haven't completed anything yet, so there will be more to come of that. So how do you push the envelope? High power Fractora is great. The skin really can tolerate higher energy. The only caveat to that is if you do it on the face, I have seen, on the body, I have seen the scabs last slightly longer. So when I've maxed out the settings on the chest, typically they lasted about 2 to 3 weeks. Even on the abdomen, it did take a little more time for the skin to turn itself over and clear those scabs. The face is a little bit quicker, usually 5 to 7 days on a high power setting, the scabs will be cleared. So what do you tell your patients to expect? During the treatment, they're going to have some pain if they're awake and not numb, or you're not doing some kind of tumescent. So you want to make sure they're comfortable. You want to make sure you know their skin type before the treatment and treat them appropriately. Make sure you're honest with them about the number of sessions that you're telling them they'll need. You know, I thought maybe high power we could get away with 1, but what I found is when you do a second one at the high power, the results are even better and patients are even happier. This is the immediate response that you'll want to see. The edema around the tips, that's great. 48 to 72 hours later, you see some scabbing. The pigment has gotten a little bit darker. And now less than a week later, actually, that pigment has sloughed off and the scabs are pretty much non-visible at that point. So the results, they're great for anti-aging, it's great for skin contraction, neck. It gives a wonderful lift. You soften those deep wrinkles that you see in the neck significantly, especially when you combine this with Forma. And you see continued benefit with multiple procedures, even when you use high settings. So initially when I started doing this, I told patients if I max you out, we only need 1. What I found was I really liked my results better if I could do 2 sessions even at the high settings, and the results were that much better. Combination therapy. Fractura can be combined with many things. I started combining Fractura with surgery, including facelifts and blepharoplasties. We just avoid the skin flaps. Injectables, we wait until the Fractura is complete and then we do the injections. And then the Fractura and the Forma. The nice thing about Fractura and Forma is you can do the Forma first and Fractura on the same day and then have them come back a week later for additional treatments. This lady had a facelift. She is 55 years old, and she actually was from out of state. So she flew in for the facelift, stayed a week, and then flew back home. So I haven't seen her yet since this photo was taken. And what I did was I did a 24-tip pin, 60 millijoules per pin, double stacked, single pass, at the nasolabial fold, oral commissure, and marionettes, and then 60 tip, 60 millijoules per pin, single pass over the forehead, nose, malar area, nasolabial fold, and chin. So basically what I avoided was this triangle over here because that's where our skin flap was elevated. And Dr. Bitar did not want to risk compromising the blood supply. As you can see from her post-op picture, she has some erythema, but some scabbing still is up here. This is a week later, and you can see how much brighter her skin looks. Of course, the facelift results are always phenomenal, but focus mainly on the skin. You know, it's going to look tighter, it's going to look smoother, her folds are better, the corners of her mouth are better here, and that's just going to continue to improve. This lady is 78 years old. She wanted to look better for her grandson's wedding, and we had a limited amount of time, and she wanted a facelift, but she couldn't because she had cardiac issues. So we didn't stop her Plavix because she had fresh stents put in, and we got clearance to go ahead with this. This is what she looked like before. She hated her mouth. That was her biggest concern. The other thing she hated was right here under her eyes. Now, interestingly enough, this lady wanted nothing to do with Botox. So I could do whatever I wanted to her, but no Botox. So the first Fractura, we did a 24-tip pin, 40 millijoules per pin, and a single pass, and then a 60-tip pin with 40 millijoules per pin. My second Fractura, this is actually a week later. So you could see how well she healed. I did 24-tip pin with 50 millijoules per pin, double passed in all of the areas that had deep wrinkles, and then I did a 60-tip pin with 50 millijoules per pin. What I found in our older patients is the nerves are not as sensitive as we age. Everyone knows that, and so they can tolerate the higher energy in the office with topical anesthetic and a Tylenol number 3. And so she was fine with that. She actually had like a pain scale of 2 during the whole procedure, which is like shocking to me. So this last one is 2 weeks after the last Fractura. I put fillers in her, and this actually is a week after I did the fillers for her. She actually took 5 syringes of filler, believe it or not, and she was thrilled. Okay, so the Fractotal facial. Typically, we want 6 to 8 sessions of Forma and 1 to 2 Fractura treatments. Forma gets done immediately before the first Fractura, and then in 1 to 2 weeks, we start the remaining of the Forma treatments. The only thing I've noticed with this that I would caution you on is that if I am pushing the envelope with higher Fractura and a week later I'm doing the Forma, you can see the new capillaries dilate, and they can be very aggressively dilated. I get nervous that I'm going to rupture those new vessels. If I see that, I stop the Forma and I wait another week. So their downtime is really dependent on the settings you use for Fractura. You can push the envelope, certainly. It works great, especially in the periocular area. Patients that have some laxity under the eye and some deep wrinkles, they want to treat and get some improvement, but they don't want surgery. Doing an aggressive pass with Fractura, double stack, double pass with a 24, and then with a 60 over it, and then following with a series of Formas, patients are thrilled. If there's any pigmentation that doesn't get addressed with the Fractura, you can also add the Lumecca. However, you can't do it all on the same day. So the IPL usually would be 3 weeks after the Fractura and on a different day than the Forma. This lady was not happy with her eye, so here we did a 24 tip, 40 millijoules per pin. I double stacked and double passed this area around here. So, and then I did a 60 tip, 40 millijoules per pin single pass. Now, this result is 6 weeks after this. So 1 treatment, no Forma, You could see how the eyelid is contracted here. The upper lid too. I didn't use eye shields. What I did was I pulled her eyebrow up and I was able to get one pass right in here. So that's why you see the lift and the upper lid. And then I went all the way underneath here as well. I am planning to, actually I just did the second treatment on her last week and she is thrilled. The other thing I want to point out too is notice all the pigmentation here that cleared just from that one treatment. Again, here's another picture. You could see, you know, I admit her eye position, she's kind of gazing up here, and this one she's not. However, you still could see the overhang and her eyelid significantly improved, as well as the texture of the skin under the eye, much tighter, much smoother. So I can't wait to see the results in the next one on her. This lady came to me because she had Juvederm injection and had a Tyndall effect, and she had these granulomas here for about 2 years after the injection, and then, by the way, she just didn't like the bags under her eyes. So I thought, well, let's try some Forma under the area and see what happens. And it turns out it actually improved the appearance of those grooves, tightened them up, and improved under the eyes. She was so happy, in fact, that she came back to do another area and also to do Frectora around her eyes. So this picture is 10 months after we completed the series of the Forma to the nasojugular groove. Each treatment was 10 minutes in the area, and basically I did 2 passes with the Forma in a C shape, so under here and then around, and I was able to get that whole treatment area. Now this is after her Frectora. So combining them can be done either together or separated, as we did here. And this is the 24 tip pin, 40 millijoules, double stack, double pulse, followed by a 60 tip, 40 millijoules single pass. And you can see 2 months later the amount of contracture she had. The divot here is significantly less. The left side, it's almost non-existent. The other thing that was interesting is during this treatment, these little granules, granulomas, started coming out where the needle marks were from the Frectora, which was great. She was so happy. Now, she was so happy with everything, she decided to do Forma to her nasolabial folds and her neck. This is only after 3 treatments, and you can see what an improvement that is. This gentleman was 18 years old. He had a 60-pound weight loss. He did not want surgery on the pectoralis area. He did, however, want an abdominoplasty. So at the time, we decided to max him out with the Frectora, 24 pin, 62 millijoules. This is before double stacking became more popular. He also was concerned about his stretch marks. And you can see here, to this picture, they are improved a great deal. The laxity here and the lift he got from the areola position is significant, and this sulcus here is much better as well. In addition to the Frectora, I recommended the Forma just to get a little more tightening on this. The pectoral area was divided into 2 zones, and each zone was treated for 10 minutes with a cutoff of 43 degrees and a rather high setting of 55 millijoules per pin. This lady was actually recommended an abdominoplasty for the laxity of skin, and here she's bending forward at about a 25 to 30 degree angle. She did not want surgery, and so we offered her the Frectora plus Forma, and she was treated with 8 sessions of the plus and 1 session of Frectora with a silicone-coated tip. For her, I didn't really think she needed anything other than the skin tightening, so that's why I chose the silicone-coated tip, and you can see here how much better the laxity is in the entire abdomen. Plus, from the Forma, the definition she has, you can really see her muscle definition a lot better. And this is actually, she actually is 3 pounds heavier here than here. And she's a petite lady, so that is a significant change for her. This lady also had this scar. In addition to everything else we did, this was treated with Body FX. This scar was treated with Frectora. 1 session. This is I believe 12 weeks after the treatment. And I did use this silicone-coated tip because that's what I used on her abdomen. If I was choosing anything for a scar, I probably would choose a non-coated because I would want the ablation from the top all the way down to the dermis to get the most out of the treatment. Thank you for participating in this webinar. If you have any questions, please contact InMode. We'll be happy to answer any of your concerns.